Hello, this is John Black, Super Chemist. You can see the name of the channel here, Trigonometry Trans Clinic. You can see the name of it if you want to watch this whole thing in, full whatever. This is a person. She's not a doctor. She's an administrator that used to work at one of these trans clinics for children. Okay.
Mental health was getting worse once they started the blocker. And that's against what the narrative tells us. The narrative says these interventions are supposed to make people better. We were pretty much putting anybody on testosterone at 13 and a half if that's what they wanted. It was getting to the point where we were harming more patients that we were helping, just by the numbers. What I am not in agreement with is this push to rapid medicalization of children. And it got to the point in the center where there was an actual directive that we were no longer allowed to use the phrase, "I have concerns about a patient." And in medicine, that should scare anyone.
My special guest today is a whistleblower from a transgender clinic in the United States. Jamie Reed, welcome to Trigonometry.
Thank you for those questions. So I'm Jamie Reed. I have a Master's of Science in Clinical Research Management, and I was previously the caseworker in the Pediatric Transgender Center at a clinic in St. Louis, Missouri. So in the middle of America. I spent about 4 years and 4 months in that position. I worked at the university previous to working with trans kids. I was working with young adults who were HIV positive. I have a lot of experience in case management. I worked with kids who are in foster care, and I've also worked in a lot of medical and health settings too. So I came into the clinic really excited about the opportunity that I thought was going to be to help trans youth and their parents.
And you mentioned in your article that, you're very progressive, you're married to a trans man, or in a relationship with a trans man. Sorry, I don't remember which. But in any case, you're married. Well, congratulations. Yeah. So very progressive, you come into this place wanting to make a difference, I assume. Mm-hmm. And then over a period of time, you start to have doubts and you try to express doubts, and that doesn't go particularly well for you. And increasingly, you become very alarmed at what you're seeing. So talk to us, just at the very beginning of that journey. You get there, you're all pumped, ready to go, and what happens?
Right away, I was struck by the lack of organization for the center. So there was no real written protocols. It seemed like it was kind of a fly by the seat of the pants kind of operation. They had already been open for a solid year before I got there, and yet it seemed like they were kind of operating outside of a lot of the normal structures that you'd see in medicine. Most of the departments and divisions in medicine have a lot of layers. There's a lot of top-heavy. There's a lot of, administrative roles, and it seemed like this center was kind of off on its own, had this little pocket, and I was also struck at the very beginning because the administration of this hospital left this clinic open, and I was told that they originally thought that they were going to have about 50 patients total. And when I left, we were close to 2,000.
Wow.
Yeah, huge difference.
Wow. And why do you think that was, Jamie? What do you think were the reasons for that?
I definitely have come to believe that in the United States there is an element of social contagion in play going on with young people who are seeking out care in gender centers. And I'm not the only one to believe that. I had lots of parents report very similar things, and there were even a number of patients in the center who would report and directly said, I only got this online.
Wow. So they only got this online, because your article is very interesting, because you talk about when you started in the center, it was mainly boys suffering from gender dysphoria, and then you started to see more and more girls come in.
See, that's one of the things that I brought up on previous channels that got banned. So now I'm redoing all my videos again. But anyways, this disorder, where gender dysphoria, it happens predominantly in males, not in females. It's actually, it might be 0.002% of trans people, but only a small fraction of those are actually women to female. I mean, female to male. They're all male to female for some reason. Whatever the causes the disorder is, it happens more in males. Now all of a sudden, it's happening in females a lot more. Same way with the autism. Tourette's syndrome went up by like 4,000%. That Sybil disorder. Remember Sybil? She had all these personalities inside herself. A split personality disorder. That went up like 4,000% too, or some crazy number. You know what I mean? It's because they're just lying to these people, these kids, little children.
Were they the ones who were particularly susceptible to this social contagion, as you put it?
I think it's well known in medicine that adolescent girls are just more open and more susceptible to many different kinds of social contagions. That has to do with a lot of ways that girls are socialized, but also the way that girls interact in kind of group settings and pick up things and show empathy with those in their group setting, oftentimes by taking on attributes in those group settings. So I didn't just see that these kids were picking up gender as a social contagion. We have a lot of issues right now in my country with adolescents who are experiencing tic disorders. They think they have Tourette's. There's been a recent wave of young people believing that they have what they refer to as DID, so multiple personalities. You are seeing these things directly coming from social media.
And Jamie, can I ask you a question? And sorry to sort of appear picky, but before you started talking about how adolescent girls have certain problems, you kind of did like a little sigh, almost like you're resigning yourself to having to say. It was part of your experience that even that very idea was controversial in the environment that you were operating in?
So you'll have to remember that in some ways I am deprogramming my language out of some cult-like conversations. So even for me, I still take pause in using the phrase adolescent girls, because when you work in a place like this, you don't say that. You say people are assigned female at birth. You don't say people are boys. You say they are assigned male at birth. So even the way that we spoke about everybody was in this framework of the gender ideology world.
Yeah, they want to dismantle and destroy society. If you're feminist, it's a patriarchy, which includes everything. And if you're a communist or woke, it again includes everything. And in both cases, they say they want to not only dismantle everything and destroy everything in society, every aspect of it, all the way down to the way people think and speak.
Wow. So I know that to you this seems kind of like normal, but to a person outside of that space, just to clarify, in this transgender clinic, you would never refer to people as boys or girls or men or women. You would say assigned female at birth.
That's transphobic to do so.
Wow.
Okay.
But but even though biological sex is obviously real.
Oh, yes. Medicine is really interesting in this right now, because in some ways all of the doctors would clearly acknowledge biological sex. You would say someone was assigned female at birth, assigned male at birth. Maybe you could use natal sex. They acknowledged its existence because if you're in the emergency room and you have somebody who's coding and you're trying to figure out, what their lung capacity is, there are.
See, this is, sooner or later, if Trump didn't get into office, this would be a problem. People are going to be going to the emergency room, these crazy nut jobs, telling their gender instead of their biological sex, and then things are going to be done different to them, with their medical procedure, and it's going to kill them because they thought that they were this certain gender, and that, trumps biology, which it does not.
There are definite medical needs and times when your biological sex changes the course of the treatment. But in our patient population, everyone was assigned female at birth, assigned male at birth. You heard the term cis a lot, who's cisgender. We talked about how all of our patients were probably, would judge you if you walked in and they thought you were cis. Those kind of things. It's constant.
And Jamie, how did this affect this type of language? How did this affect the way that you treated your patients?
I do think that the staff were always sort of on edge because it wasn't just the concern that you were providing good medical care, but you also always had the concern, has this patient's pronouns changed again? Their preferred names were changing frequently. Even the term preferred name, sometimes people would say activists would push that you can't even say that because it's not their preference, it's their name, even though it's not their legal name. A lot of the staff that are hired into the clinics like this, at least in the United States, are also activists, and oftentimes there's a push to directly hire trans and LGBTQIA people to work in these clinics as the staff.
And so you join the clinic, you start working, you start noticing some of these things. And when did you start to get really concerned? Because you were the person responsible for processing the intake of potential patients. So you're getting these people in and going, you go here, you go there. When did you feel like, whoa, like this is not good?
It was a slow process to get there. There definitely was a point where I went from 10 intakes a month, where there would be 10 newly referred young people, to the numbers being in the 40s and 50s every single month. And the cases were getting more and more outlandish, or sometimes even completely bizarre. In the States, oftentimes if anything about gender gets brought up in a pediatrician's office, they immediately just refer you to the gender center. So I could be getting an intake where a kid maybe told their parent 3 days ago that they thought they were non-binary and asking for they, them pronouns, and yet they're already landing in a specialized medical clinic that does hormones. So there were some intakes where it was just, it made absolutely no sense. The entire concept of kids being allowed to explore their gender and explore these concepts have been almost wiped off the map.
And what would happen? Let's say I bring my 12-year-old daughter to you. 3 days ago, she said that she's non-binary. She wants they, them pronouns.
The minute you're talking to me on the phone, you have already started on a pathway. Because the only therapists that I have to refer your kid to are therapists who are going to affirm their gender identity, not...
Keep in mind, it's illegal now to not immediately affirm these children. If a child comes to a psychologist, if he says, and the kid says, I'm in the wrong body, I'm in the wrong sex, if the psychologist asks one question, are you sure? That's it. He can lose his license. That kid could